Joining me now is Mr. Haitham Hamoda, consultant gynaecologist and chairman of the British Menopause Society. Welcome. Thank you so much for joining us. Let's start right at the beginning. What are we talking about here? What is menopause from a medical point of view?
Menopause marks the end of the reproductive life cycle, and as a result of that, there is a reduction in the production of the hormone estrogen, among other hormones. So it can result in a range of symptoms. Hot flushes and night sweats are the commonest symptoms, so about 75% or so of women experience them, but a significant proportion of women experience other symptoms, such as sleep disturbances, insomnia, changes in mood, low mood, anxiety, irritability. All of these are symptoms of estrogen deficiency. Changes in sexual drive and libido. Again, many women may not feel comfortable talking about them, but they are quite significant and can have a detrimental impact on many. Changes in memory, concentration, sensation of brain fog. Many women describe that. Joint aches. All of these are common symptoms, as well as vaginal dryness and urinary symptoms that many women may experience as a result of this.
You've mentioned so many different things there. So how would someone know that this is what is happening to them?
So we do see many women who experience symptoms where they will say, I'm feeling my mood is down, I'm feeling anxious, I'm forgetful, my memory, my concentration is not great, I'm getting this constant brain fog. What's causing it? Some people do think, am I getting dementia? What's going on? Why am I getting all these symptoms? And also, people often assume that you will only get the symptoms when you become menopausal and your periods stop. But many women experience troublesome symptoms, significant symptoms in the perimenopause while they're still having menstrual cycles. And of course, it's relevant to keep that in mind when women experience this cascade of symptoms or any of them.
My question, I suppose, is, so you talk about this cascade, you talk about all these different symptoms. So when would you advise somebody to go and seek help, look for information, perhaps try and do something about it, and join the dots together?
Yeah, you could say the average age of the menopause is 51, but the range could be anything between 45 to 55. But when we say that is the range of the menopause, 5% of women can go into the menopause between 40 and 45, 1% before the age of 40. So if the symptoms are ongoing and you have concerns, we would say it is relevant that one would go and seek advice.
So where should they go? I mean, that's a kind of simple question, isn't it? But where do you get the right information and get, if you need it or want it, treatment?
And of course, there is now much information out there, especially now with the internet and social media. But unfortunately, there's also plenty of misinformation. So what we would advise women and as well healthcare professionals looking after them to look at the British Menopause Society website, at the patient arm of the Society Women's Health Concern. And there are plenty of information there in the form of videos as well as written information to explain what the menopause is, what you can do about it, what is the role of HRT, what are the lifestyle factors you could take. So as you rightly highlight, accessing accurate information is relevant to guide women in that respect. What we would like to see is a proactive preventive approach where women at 45 and beyond will have a well woman check that will include information on the menopause.
The fact that we're here talking about menopause is great, and there is a sort of sense that the conversation is changing. Why has it taken so long to get to this point, do you think?
Unfortunately, there has been much negativity around the menopause and emphasis on the negative aspects of HRT. And in years gone by, there's also been little reference to the potential impact the menopause may have on quality of life of many women.
And there was a report which caused a lot of consternation, wasn't there, about breast cancer? But let's just address that. What would you say about it?
The answer is that combined HRT in the form of estrogen and progestogen can result in a small increase in the risk of breast cancer. However, that increase is small and the risk is low, both in medical and statistical terms. But what would be relevant to emphasize is this should not be taken in isolation. So this should be taken in the context of the wider benefits as well as this risk when you talk about HRT. In other words, talking about the benefits and quality of life improvement, but also the significant reduction in osteoporosis and osteoporosis-related fractures, the significant reduction in cardiovascular disease and cardiovascular mortality, and for that matter, all-cause mortality.
What strikes me about that is this is when many of those women will be having, they'll have young children, perhaps teenagers, they might have older parents they're looking after, they might be having a career as well. This comes at a very critical time of life, doesn't it?
Absolutely. But of course, the point to say is that there is help for these symptoms. For most women with advice, with help, potentially with treatment with HRT, most of these symptoms can be controlled. And for many, you can get them back to a place where they could carry on with things as they would do normally.
And you really get a sense then of how important this conversation, other conversations surrounding it are. I suppose important to say not everyone will have, really difficult symptoms, will they?
That's a relevant message, again, to send. So it's a range of presentation. So if you look at it, you can say that more than 75% of women experience symptoms, but not all women will experience symptoms. However, a significant proportion will. And also, about 25% of women will experience severe symptoms. So it is important that we individualize management and rather than applying a one-size-fits-all approach. So it is an opportunity to say that you have a discussion to look at lifestyle modifications, so optimizing weight, looking at diet, exercise, reducing alcohol, stopping smoking, a whole range of other interventions, including the treatment options. It's a question of providing information and making women aware of where they are and understand their choices to help them make an informed decision.
Thank you very much indeed for your time. Thank you.
Okay.